every teacher to be a counselor. Now, what is counseling? I will give you the details and requirements of a counselor. At the end, I'm sure that you would come to a conclusion that you can be a wonderful counselor in your institution. Counseling is essentially a helping activity. Counseling is a helping profession, like medicine, like law, like nursing. Counseling also is a helping profession. We help people, those who are in need of help, those who require help, those who require your service. We provide services through counseling. Every teacher, I say, is a counselor. Probably you are a lay counselor now. But if we acquire some amount of training, I'm sure that you would be a professional counselor. Every teacher is a counselor. And because by and large, we say that all teachers have the qualities to become a counselor. Teachers know the needs and interests of students, the abilities and the problems of students, because they observe them very keenly, both inside and outside the class situation. But definitely, counseling services will improve your relationship with the students. But don't be under the impression that counseling means giving advice. Counseling means providing a ready-made solution. This is not counseling. Counseling means it is a self-help activity. We help people in such a way that they help themselves. Essentially, counseling is a helping activity. What type of help we provide to students or to others or to any one person? Such services or such help can be classified into two. One is proactive help and another is reactive help. Proactive and reactive service. This is applicable to doctors, applicable to lawyers, applicable to nurses, applicable to counselors also. What is proactive help and what is reactive help? A reactive service means when help is given to someone who asks for help. Someone has asked for help. Someone has come to you for help. You are helping him. This is called reactive help. Or you are reacting to the need of other person. Somebody requires your assistance or your service. You go to him and provide services on your own. This is also called reactive services. Reactive help means when somebody is in need of help, you are reacting to his need. You are helping him. You are serving him. This is called reactive help. Somebody has come to a doctor. One person has come to a doctor. He provides help to him. Or somebody is not well. The doctor himself goes to him and provides service to the patient. This is also called reactive. The same is applicable to counseling also. You are reacting to the requirement of other person. This is called reactive help. Whereas a proactive help is slightly different. Proactive help means you are giving help to another person. You are helping other person because of your requirement. Please understand, I am helping someone not because he has come to me, not because he is in need of help. I am helping him for my satisfaction, my self-satisfaction. This can be compared to that of dana. Dana maduvodu. In dana, you go to a person and you request him to receive either godana or gold, whatever it may be. This is called dana. That means serving others is your requirement. You get satisfaction by doing service. By helping other persons, you get satisfaction. This is called as proactive help. Proactive help means it is for your self-satisfaction. I have done something good. I have helped people. This is my satisfaction. So this is called as proactive help. Between the two, proactive help is more important than reactive help. Okay, this is the two types of help. Now, coming to counseling, we provide different forms of counseling. Sometimes we refer counseling as a talk therapy. Talk therapy means where a person comes with a problem. Maybe an emotional problem or a mental health problem or interpersonal problem or any type of problem. Your main service is through talk. There is no equipment, there is no machinery, there is no technology involved here. In counseling, the only weapon you have or the only technique you have is to talk to the person and understand him and provide solution to his problem. That's why we say counseling is a talk therapy. How effectively you talk, how effectively you communicate, that's important. There are three types of counseling broadly. One is face-to-face counseling. The second is online counseling. And third is telephone counseling. So the first one is face-to-face counseling or personal counseling, where you sit with the person, talk to him, listen to his concern, and finally solve his problem or provide solution to his requirement. This is called as face-to-face counseling, where you sit before him, look at him and talk, listen to him carefully, understand his problem, interact well with him, talk to him, and finally provide solution to his problem. This is called face-to-face counseling, the most prominent form of counseling. This is adopted everywhere. The second one is online counseling. Online counseling means it is as good as face-to-face counseling. More convenient in terms of time and energy. The person need not come to a counselor. He need not stand in the queue. He need not be identified by other persons also. He can talk to him. He can sit at home and talk to the counselor. He can get solution to his problem. There is no stigma attached to online counseling because nobody knows, nobody identifies you. This is highly confidential, privacy is there, and hence this is the best form of counseling compared to other forms like telephone counseling. You don't want to be identified by others. Suppose a person has a mental health problem, you go to a psychiatrist. Your worry is not about your problem. Your worry is more about how many people are observing me. How many people are identifying me that I am a mentally ill person. People brand me mentally ill. I don't want that branding. I don't want people to look down. I don't want people to make fun of me. This is called a stigma. In online counseling, the advantage is there is no stigma attached to it. But only problem is you can't depend on technology completely. You can't depend on, there is no anonymity or privacy here. Somebody may enter also. Somebody may knock off those things. Probably people may blackmail you also afterwards. One should be very, very careful with online counseling. But very much advantageous in terms of money and time. You need not go there. You need not stand in the queue. You need not wait for a person. You can take an appointment according to your convenience and talk to the person online. This was the practice during COVID time. During COVID time, online counseling was very, very popular. The third one is telephone counseling. Telephone counseling offers the same service as face-to-face counseling, except that it is conducted over phone, that's all. You don't see the person. You can't understand his emotions. You can only listen to him, that's all. In the past, this medium was predominantly used for crisis intervention. Crisis intervention means when somebody is in difficulty, you can contact the phone, through phone. This is telephone counseling. So 3 forms of counseling. Telephone counseling is good. Online counseling is very good. And face-to-face counseling is the best. Okay, these are 3 forms of counseling. Now let's come to the terminologies. There are certain terms which we use in hello? Is there any question? Anybody? Okay, friends, if you have a question, please wait till the class, till the end of the program, and I will give you sufficient time to raise the questions. Okay, the key terms used in the program, in the whole lecture is counselee. So, who is counselee? Counselee is otherwise known as client, beneficiary, or mentee, or protege. We use different terms in different contexts. Counselee means the person who receives the services. A person who is in need of help is called counselee. The person requires services. The term counselee is also very similar to client. Client means the person who has a right to receive service, a beneficiary. So he is called client. Please understand, the terms counselee and counselor are not protected titles in India. When they say protected titles means anybody can use the term counselor. You can say from tomorrow onwards, I am a counselor. There is no objection at all. Nobody can say no to it. But you can't say that I am a chemist unless you have a qualification in chemistry. You can't say that you are a lawyer unless you have a qualification in the law. But to say that you are a counselor, nobody will insist your qualification, a qualification in counseling. Only in few occasions only we insist for qualification to become counselor. In all other contexts, the term counselor, the term counselee, both are not protected titles in India. They are not protected. Anybody can use it. So counselee means a person who is in need of help. Counselor means he is a professional who provides services. He provides services to people, those who are in need of help. We use the term therapist, as I said. We use the term therapist. We use the term mentor. We use the term helper in different contexts. So counselor is a professional. He provides services, as I said, either reactive service or proactive service. And he is the person who is qualified in counseling. I'll inform you afterwards the requirements of a counselor. Okay, the third one is code of ethics. Code of ethics means a written set of ethical and value-based principles for any profession. Medical people, they have code of ethics and values which they have to follow. Law professions have code of ethics and values which they have to follow. Counselors also have certain ethical issues which they have to follow. These ethical issues will help you in decision making. So what do you mean by ethical issues? Ethical issues refer to your what is correct and what is not correct. In the sense, what is that you are expected to do? How you are expected to behave? Counselor is expected to behave in a particular way. Counselor is expected to do these things. That's what we say, do's and don'ts. Do these things, ethics. Don't do these things, unethical. There are certain ethical aspects, unethical aspects are there. Ethical aspects means what is being allowed, what is accepted. It is either in the written form or not in the written form also. Certain ethical issues are adjudicable. When I say adjudicable means if you violate these ethical issues, you have to face, legal proceedings will be initiated against you. Follow ethical issues. Certain ethical issues are very, very powerful. So one should not violate the ethical issues. Ethical issues are important, like roots are important for a tree. The same way, ethical issues are important for a profession. So these ethical issues refer to right and wrong behavior on the part of the counselor. Don't do these things. Do these things. Okay. Be loyal to your conscience. Is an ethical issue. Manasakshiki viruddhavagi hogubedi. Be loyal to your employer. Be loyal to your employer. You are working in a government college, loyal to government. Next is be loyal to your profession. Whatever may be your profession. You may be from sociology department or economics or it. Be loyal to your profession. Treat everyone equal. These are all ethical issues. I just note, I give you some ethical issues. Treat everyone equal. Don't discriminate on the basis of caste or creed or anything. Maintain confidentiality of the privileged information given by the person. Don't accept any gifts from the person. Do not cross your professional boundary. Work within the boundary of your profession. If you are a counselor, be confined to your work of a counselor only. Don't do other work. Do not use your authority for your personal purpose. And don't have any dual relationship. Dual relationship means when a person comes to you for help, he is called as a client. I say that you should have that relationship only with the client, professional relationship. I am a teacher and he is a student. My relationship should always be that only. It should not go beyond that. If you have any other activity in addition to being a student, that means it's called dual relationship. No dual relationship. Do not promise if you are not able to fulfill it. These are all the important ethical issues in counseling. These issues you have to follow. Maintain the record properly. Keep the record confidential. Whatever information that is given by the person, keep it confidential. Maintain privacy. Talk to a person when he is alone, not in front of others. Don't talk to him in front of others. Call him separately to your cubicle, to your room, and talk to him. That's best form of counseling. Okay, code of ethics. Next comes confidentiality. Confidentiality is an ethical issue. A professional, as a counselor, you have to keep the information given by the person. You have to keep it confidential. When I say confidential means you should not discuss these issues with unconcerned persons. Client ye vishaya helidro, vyakti ye samasya helidro, aa samasya ನಾವು ಬೇರೆ ವ್ಯಕ್ತಿಗಳ ಜೊತೆಗೆ ಹಂಚಿಕೋಬಾರದು. Don't share the confidential information with the unconcerned persons. Keep it confidential. The person may say so many things before you, believing you, trusting you completely. ನಂಬಿ ಹೇಳಿದ ಮೇಲೆ ನೀವು ಬೇರೆ ವ್ಯಕ್ತಿಗಳಿಗೆ ಆ ವಿಷಯ ಹೇಳಿದ್ರೆ, if you leak out that information, if you publish it in a newspaper, or if you publish his photograph in a journal also, they are all violations. That's called as a breach of trust. Breach of trust means ನಂಬಿಕೆ ದ್ರೋಹ ಮಾಡುವುದು. A professional has to keep the information given by the person confidential. A student may come to you with a problem, most personal problem. He may share the problem with you, or he may ask your guidance, he may ask your help. Behave like a professional. Keep that information confidential. Don't leak this information. Don't tell this information to other persons. You promise him. We promise the person that whatever information you give, that will be kept confidential. That will be kept confidential. But please understand, confidentiality does not mean that keeping everything only in the mind only, not sharing with anyone. So confidentiality means it is relative confidentiality, but not absolute confidentiality. Absolute confidentiality means whatever information that is given by the person, by the client, you keep it in your mind only. You don't write anywhere. You don't make a note of those things. You don't discuss with your professionals also. You don't discuss with anyone. It will be with you only. This is what we say absolute confidentiality, which may not be possible also. You can't keep every information in your mind. This is called absolute confidentiality. This is not possible to practice. What is that you can practice? You can say a relative confidentiality means I promise you that whatever information you give, that will be kept confidential. But if the authority asks for information, the court asks for information, the court may ask you, what are the details? Give me the details means you have to submit. You have to give the information. So under certain circumstances, you have to give the information to other persons. The person who says, sir, I am very much depressed. I want to end my life. I want to commit suicide, but don't tell these things to other persons, sir. But you have to inform. You have to inform. The reason is life is more important. Problems are part of life. Problems can be managed easily, but life is more important. So, in certain circumstances, you can violate the confidentiality. Your own confidence. You have promised, but you are violating it because it is inevitable. When there is a danger, when there is a danger to the person, when there is a danger to other persons, then the question of confidentiality will not come here. You have to save the life of the persons. So, examples of confidentiality. The doctors have to maintain the medical history given by you. Business people maintain information confidential, certain information only, not all information. If you are a researcher, you have to maintain confidentiality of the information given by the subject. The person may give you data. You talk to a person, you interview a person, and you also tell him that whatever information he gives, that will be used only for the research work only, not for any other work. That is what we say confidentiality. Use the information only for your research work only. That is confidentiality which you have to maintain in the research work. So here also, you have to maintain confidentiality. Then, diagnosis. Medical diagnosis. In medical diagnosis means the doctor examines the patient, gets information from him by asking questions, by interviewing him. By asking questions, he gets the information from the patient. So you ask questions, get the details. Physical examination will be done by the doctor. Send the patient for investigations, either for a blood test or urine test or for chest X-ray or anything scanning. You talk to the relatives also. Whoever comes along with the patient, mother or father, you talk to them also. After gathering information from all sides, you arrive at a conclusion. That's called diagnosis. The first one will be in investigation. The second is, on the basis of investigation, you make a diagnosis. On the basis of diagnosis, you plan the treatment and implement the treatment. This is the process which medical people follow. The same process we follow in counseling also. The person has come for help here. The person has a problem. Then what do? You investigate. You talk to the patient, client. You talk to the family members. You talk to all other important persons also. Get as much details as possible about the person, about the problem, about the situation. After getting all the information, then you have to say, what is the problem of the person now? In medical thing, you make a diagnosis. But while making diagnosis, please make sure that diagnosis on the basis of few facts is hazardous. Don't arrive at a conclusion on the basis of few facts only. A doctor should not make a diagnosis in a hurry. A good doctor will take more time for diagnosis and less time for treatment. A bad doctor is reverse. You make diagnosis in a hurry. In most occasions, your diagnosis is wrong only. So, don't make a diagnosis in a hurry. The same is applicable in counseling also. Don't come to a conclusion in a hurry. your conclusion or your diagnosis may be wrong. Sometimes a symptomatic treatment is required in medical case. Symptomatic treatment means when you are not able to make a diagnosis, what do? The doctors will go for symptomatic treatment. For first symptom, this is the treatment. Second symptom, this is the treatment. Because it will take some time for making a diagnosis. Sometimes they go for differential diagnosis. Differential diagnosis means when you are not sure of a diagnosis. For example, the patient has come with 10 symptoms. Out of 10 symptoms, 5 symptoms are in favor of one disease. 3 are in favor of another disease. Probably some symptoms are in favor of tuberculosis. And some few symptoms are in favor of pneumonia. So we are not sure what is the diagnosis. When you are not sure of a diagnosis, what do? That is called as a differential diagnosis. Okay, out of so many symptoms are in favor of tuberculosis. But some symptoms are in favor of pneumonia also. So my first diagnosis is tuberculosis. Put a question mark. Treat the person for tuberculosis. Closely monitor the case. When there is improvement in his condition, that your diagnosis of tuberculosis is correct. When there is no visible improvement in the condition, then you have to think of alternate diagnosis because your diagnosis is wrong. So same is the case in counseling also. Get information about the person. And don't arrive at a conclusion immediately. What problem the person has? What is the cause for his problem? How far we can help him? That is called as prognosis. In medical terminology, prognosis means the chances of recovery from a problem. The patient has come with a problem. Naturally, as an attendant, as a family member, you would ask the doctor, "Doctor, ಇವ್ರಿಗೆ ಏನಾಗಿದೆ ಪರವಾಗಿಲ್ಲ ಎಲ್ಲ ani." ಇಲ್ಲ, ಇವರಿಗೆಲ್ಲ ಪರವಾಗಿಲ್ಲ, ಪ್ರಾರಂಭ ದಶೆಯಲ್ಲೇ ಇದೆ. So recovery is possible. That's what we say prognosis is good. When we say prognosis is good means the chances of recovery from the problem are plenty. Excellent chances are there. Wonderful chances are there. With this treatment, he will be all right. That's called good prognosis. For certain cases, we say bad prognosis. Bad prognosis means difficult to treat. Difficult to treat. You have come at the last stage. Now this is the third stage of cancer. ಈಗೇನು ಮಾಡೋದಕ್ಕಾಗೋದಿಲ್ಲ ಸ್ವಾಮಿ, ತುಂಬಾ ಲೇಟ್ ಮಾಡಿದ್ರೆ ನೀವು ಅನ್ನಿ. ತುಂಬಾ ಲೇಟ್ ಆಗಿ ಐಡೆಂಟಿಫೈ ಆಗಿದೆ. ಲಾಂಗ್ ಡ್ಯೂರೇಷನ್. This is called as bad prognosis. Prognosis is not favorable. So in the medical terminology, prognosis means the chances of recovery from the medical problem. In counseling, the prognosis refers to the chances of helping him. How about the chances? Chances are very good. We can help him. So this is the process which we follow, psychosocial diagnosis. Okay, sometimes you can't wait for the diagnosis. Diagnosis may take more time. So that's why we say we go for symptomatic relief in medical terminology. Same is applicable in counseling also. But only difference between counseling and medical practice is, in medical practice, you label the individual. Labeling means you say that he is a TB, he has TB. You may go to the extent of saying that he is a TB patient. The term is not correct now. The term should not be used now. Best thing would always be a person with HIV. That is the correct one. Person with a disability, correct one. Say person with disability. There are two things are there. One is person, another is disability. The same way in counseling also we use the term person with a problem. The person has a problem. But don't say he is a problematic person. He is not a problematic person. That is a wrong terminology. Problematic person, Allah. But person has a problem. Now, what is the difference between the two? Person has a problem means person is good. We say every person is good. We believe in counseling that every person is talented, every person is good. But person has a problem. When once you remove the problem, when once you manage the problem, when once you treat the problem, the person is in good. So that's why we say person with a problem and not a problematic person. So the moment you remove the problem, the moment you solve the problem of the individual, person is good. The plant is good. The plant has a problem. What do? You don't remove the plant. You remove the problem only. And the plant is good, the plant will grow. So the plant has a problem. What do? Remove the problem, solve the problem, and the plant will grow. The same is the case here in counseling. The person has a problem. Identify what problem he has. Where is the problem? Who are all responsible for the problem? Who are all the contributory members for the problem? How do you manage the problem? Plan the treatment also. That's what we say, diagnosis and treatment. Next one is empathy. Empathy, the word, not a very old word, recent word only. The old word, very hale kaladandi term is sympathy. Sympathy is different from empathy. Sympathy means feeling for the person. Feeling for the person is called sympathy. Feeling for others. Ayyo papa yenagide. Ayyo papa andre sympathy. You understand other person's suffering. This is called sympathy. Sympathy is of less use in counseling. Sometimes if you show sympathy, the problem will be aggravated also. So the best thing always would be empathy. Empathy means experiencing someone else's feelings. I am a counselor. Empathy means I experience the problem. I feel as if I have the problem. If the same problem I have, how do I react to that? That is what we say empathy. Feeling like the person is called empathy. Feeling like him. Keeping yourself in the position of the person. Nanage aa kasta bandare. Nanage aa samasye bandare. Eshtu dukha agutte annodu yochane ಮಾಡಿ ಆ ದುಃಖ ನೀವು ವಾಪಸ್ ಹೇಳಿದ್ರೆ ವ್ಯಕ್ತಿಗೆ, that is called empathy. Empathy means listen to him first. Second thing is understand him second. And third is communicate back to him. Both verbally and non-verbally. Both are important. Listen to him, understand him, and communicate back. I understand your problem. This is called empathy. If you say that, I understand how you feel. I can feel the pain of your experience. I understand how painful it is. I understand failure in the examination ಎಷ್ಟು ನೋವಾಗುತ್ತೆ ಅನ್ನೋದು ನನಗೆ ಅರ್ಥ ಆಗಿದೆ. ನನಗೆ ಅರ್ಥ ಆಗಿದೆ ಒಂದು ಮಾರ್ಕಲ್ಲಿ ಫಸ್ಟ್ ಕ್ಲಾಸ್ ಹೋಗಿದ್ರೆ ಎಷ್ಟು ದುಃಖ ಆಗುತ್ತೆ ಅನ್ನೋದು ನಾನು ಅರ್ಥ ಮಾಡ್ಕೊಂಡಿದ್ದೆ. This is called as empathy. So you need to communicate that you have understood. That is also important. I have understood. Communicate back to him. That's called empathy. So empathy is very, very important in counseling. Show concern. Understand him. Feel like him, not for him. Ayyo Papa Andre, sympathy. No, Ayyo Papa Allah, I am there to help you. I am there to work with you. I understand how much painful the situation is. This is called empathy. Sharing the problem is called empathy. Okay, next one is observation and listening. Oh, both are there. Observation and listening. Both are important in counseling. Let us keep our eyes and ears always open. I repeat again, let us keep our eyes and ears open all the time and never fail to register what we see or listen. Listening is different from hearing. Listen with concern. Listen to understand. So listening is important because we have 2 ears and only one tongue. Only thing, the difference is we have to talk less and listen more. Counselor talks less and listens more. You listen more. Okay. We have 2 ears and one tongue only, so that we can listen twice as much as we speak. A good counselor is one who will speak less only. Listen to him and also observe him. Open your eyes and observe his body language. The non-verbal communication, body language, you can understand, because body will never tell lies. You cannot train your body to tell lies. Body will always speak the truth only. The facial expressions, you can understand. That's why we say face is the index of mind. The face will never tell lies. Even if you try also, it will not. So observe the body language of the person. These things are important. Next, paraphrasing. Paraphrasing means the term which we use in the research also. Taking the clue from the client and ask questions in counseling. Taking the clue from the client and ask questions. You said that you are telling me. You said that you are not happy in your family. You don't like any of the family members. And you also said that you have always quarreled with the family members. Can you tell me more about that? This is called as paraphrasing. Paraphrasing means whatever the person says, you are telling him back in your own words only. In research, what we do is we refer a book. One para is extremely good that you want to use it in your research work. What do? There are 2 ways of presentation. One is copying the small para, even if it is 2-3 sentences also, copying as it is. But it will be in inverted comma. So and so has said, then they write everything in inverted comma only as it is. This is called quotation. Paraphrasing means understand the para, understand the points, understand the context also, and write in your own words with a reference also at the end. This is called as paraphrasing. Paraphrasing means understanding things, presenting the things in your own language only so that there is continuity. This is called paraphrasing. Okay. Next one is privileged communication. Privileged communication means it is legally protected information. A student writes a letter to the teacher explaining all his problems. Or a student writes his experiences or other things he will write to you. This is called as a privileged communication. He is writing everything about his problem with the belief that you would not disclose this information to others. Communication between the counselor and the counselee is protected always, unless the client gives permission for it to be shared. If the client says, sir, you can give the letter to others also, I have no objection, then you can share, otherwise you should not. This is called as a privileged communication. Communication between the counselor and the counselee is a privileged communication. You should always keep it confidential only. You can only reveal it when there is some danger involved. Otherwise, you should not. Next, we have three professionals are there: a psychiatrist, a clinical psychologist, and psychiatric social worker. These three persons are authorized to practice psychotherapy, which also includes counseling also. Legally, they are permitted to use the technique called counseling and psychotherapy. In mental health settings, or in the field of mental health, psychiatrists, clinical psychologists, and psychiatric social worker, they use psychotherapy and counseling in varied occasions. They are protected by the law. The reason is we have Mental Health Care Act. In that Care Act, we have these professionals with the qualification also. A psychiatrist is one who is basically a medical man. After completing MBBS from a recognized university and college, he has studied MD, 3-year MD course in psychiatry, or a 2-year diploma in psychological medicine. He is called as a psychiatrist. MD or DPM, if both are from a recognized institution, approved by the UGC, then we say he is a qualified psychiatrist. He is a professional. He is a licensed person. He is given the license to practice mental health services. So he is a psychiatrist. A psychiatrist is a medical person, basically a medical person. Clinical psychologist. He has a degree in psychology, PG degree in psychology, or clinical psychology, or applied psychology. It can be either MA psychology or MSc psychology. After a 2-year psychology course, the person has studied a 2-year full-time MPhil course in clinical psychology. 2-year full-time supervised clinical training from a recognized institution, approved by UGC. And further, his qualification is to be approved by the Rehabilitation Council of India. Rehabilitation Council of India, it gives certificate to these people to practice. The third one is psychiatric social worker. 2-year MSW with 2-year full-time clinical MPhil degree from a recognized institution approved by the UGC. He becomes a psychiatric social worker. He is permitted to practice counseling and also psychotherapy. They come under the Mental Health Care Act. Legally, they are allowed. We have the list of all psychiatric social workers or psychologists or psychiatrists state-wise and all India level also. A separate register is maintained for the qualified persons. They practice counseling very much. Next is rapport. Now, what is a rapport? Rapport refers to a close and harmonious relationship between counselor and the counselee. And in a close relationship, a professional relationship, a positive relationship, A professional, positive, and a purposeful relationship between counselor and the counselee is called as rapport. Both understand each other. Counselor and counselee both communicate well. It is a strong working relationship between counselor and counselee, built on mutual trust, mutual belief, genuineness. This is called as rapport. The relationship between the counselor and the counselee, or the client and the counselor, should always be professional, not personal. Positive, it should always go in the right direction only, not negative. Purposeful, the relationship has a purpose. When once the purpose is served, when once the purpose is done, when once you achieve the goal, the relationship will come to an end. It should end also. When there is a beginning of relationship, there should also be an end for relationship also. When once the purpose is served, when once the goal is achieved, the relationship should cease to exist. But rapport means a good relationship between the two. Good relationship, mutual trust. I trust you and you trust me. I believe you and you believe me. When there is a mutual trust, the client will be open up, will express all his inner feelings also without any hesitation, because I trust you, I believe you. You are my well-wisher. All depends upon, the rapport depends upon how we talk, what we talk, and how we respond, and how we follow the ethical guidelines also. All depends upon the way in which you talk. Okay, next is stress. Stress is a part of life. Nobody can be free from stress. One person asked, can you have a life without stress? Means no, there is no life at all. If you want to live, you have to face the stress. Hans Selye was the first person to use the term stress in medical terminology in the field of medicine. Stress is a part of life. But too much stress may lead to feelings of frustration. Too much stress. ಬೆಳಿಗ್ಗೆಯಿಂದ ಸಾಯಂಕಾಲವರೆಗೂ ಒತ್ತಡ ಜಾಸ್ತಿ ಇದ್ರೆ ಏನಾಗುತ್ತಂದ್ರೆ you lose interest in life, frustration will be more. But insufficient stress will act as a depressant. That means if there is insufficient stress tumba kadame idre, what happens? You are not active. There is no thrill in life. That's what we said. No, there is no thrill in life. You feel that it is bored. The life is boring. So you need optimum level of stress. Not less stress, not more stress also. If there is no examination, what happens? Don't think that there is no stress. People will lose interest. People will not be motivated. People will not be inspired if you don't have examination. Some amount of examination is required, but at the same time, it should not be horrifying experience also. It should be a friendly examination. A proactive environment should be created on the campus. If you give more assignments to a person, that will be too much. Too much stress is a problem. Too little stress is also a problem. But what you need is optimum level of stress. But optimum level depends upon the person. What is optimum to me may not be optimum to you. But don't view stress as something good or bad. It is not good nor bad also. How do you react to stress is the requirement. Okay, what do you mean by stress? Stress means our reaction to the stressor. What do you mean the stressor? Like life situations are called as stressors. They are the events, occasions, conditions, or incidents. All are stressors only. Marriage is a stressor. Job is a stressor. Death of a friend is a stressor. Death of somebody, very close relative, is also a stress. Minor traffic violation is also a stressor. They're all stressors. How do you react to the stressor is called as stress. How do you react to the failure in the examination is a stress. If you take it very casually, stress is very much less. If you take it very seriously, the level of stress will be more. All depends upon our reaction to the stressor. Stressors means the incidents, the occasions, the events, the conditions all come under the category called as stressor. Our reaction to the stressor will be the stress. Failure in the examination, if it is a stressor, our reaction to the failure in the examination is called as a stress. Marriage is a stressor, but how do you react to marriage is the amount of stress. One scientist has conducted a study on stress. He found out that there are almost 143 stressors are there he has identified. That is used as a scale to measure the stress level of people. A psychologist has developed. Two others are there for the scale. According to the others, the most powerful stress, that means you give stressor, which is the highest score of stress having. The highest score is there, where the first one is called as death of the partner, has 100 score. The stress score is 100 for the stressor called as death of the partner. So death of the partner is the most stressful thing for a person. Death of the partner. The least stressful is traffic violation. It has a score of 5. The highest is the death of a person. The least one is the traffic violation. All other things come in between stressors. For example, marriage has 40. Getting a new job, 40. Death of a friend, around 30. Like this, you have a score for everything. You ask the person, read all the stressors and mark it, the things which happened in the last 1 year. If you have lost your partner, put a tick mark to the first one, 100. If there is a traffic violation in the last 1 year, put a tick mark there, 5 marks. If the score is less than 200, we say it is a 150, we say it is a moderate and very mild level of stress, okay, manageable. If it is more than 150, we say moderate stress. If it is more than 300, we say stress is really severe and the person is more prone to develop medical problems. Especially stress-related medical problems are heart problems. Heart problems, mainly heart problems, myocardial problems. So stress up to an optimum level, we say it is desirable. It is required. It will motivate a person. It will stimulate a person. But beyond the limit, it will really create more problems only. So stress is required, but it should be within the limits. Okay. But there are 2 more terms which we use. Distress. Distress means a state of severe anxiety or suffering is called distress. While de-stress, that is also different. De-stress is different from distress. De-stress, D-E-STRESS. De-stress means doing something again to become free from stress. That means relax your body and mind is called as de-stress. Do something to become less stressful. That means be away, relax your body and mind is called as de-stress. Distress is different. Distress means severe anxiety is called distress, suffering. Whereas de-stress means again going back. Be free from stress. Take a hot water bath is a good way to de-stress after a busy day. Hot water bath in the evening, you become very fresh. Or doing yoga is a way of de-stress, one way. And listen to a pleasant music also a de-stress. That means free from stress. Belagenda kelasa maadi sayankala. If you listen to the music, it is very, very pleasant. That's called as a de-stress. That means be away from stress. Okay. How to control this stress? What do you do? If you want to be free from stress, there are 3 techniques are there to be free from stress. One is forgiveness. Forget and forgive. Forget and forgive those who hurt us. Those who have created a problem to us, forgive them. And afterwards, forget the whole thing. This is one way of reducing stress. Second one is the flight or fight theory. The fight and the kusti model, or flight, you run away from the place. Fly away or fight, which one you adopt? So fight or flight. But these 2 things are not correct solutions in the present day. Think of some other alternative, something in between fight and flight. That would be the right solution. The third one is relax and sleep well. This is the best strategy. Relax and sleep well. That is Shakespeare's words. Oh sleep, oh gentle sleep. Sleep will always help you. Sleep is a natural part of life, essential for physical and mental well-being. This is how you can manage the stress. Okay, the next one is summarizing. Summarizing means at the end of the counseling or periodically you summarize. You have come with the problem. This is what you have done. This is what you have achieved. This is your progress. And this is your goal. You have to go in this way. This is called as summarizing or evaluating periodically. Is called as what the client has achieved is called as summarizing. What is that you have achieved? Where is the evidence that you have made a progress? So what is to be done henceforth? Okay. These are all the key terms which we use. The end note is the technique of counseling resolves around 4 aspects. One is listening, more important, empathy, ethics, and empowering. The ultimate goal of counseling is empowering. Empowering means making the person powerful, making the person solve his own problem, and not to make him depend on the counselor. Only in few occasions only he can depend on the counselor, but in the rest of the occasions, we want the client to take an appropriate decision with regard to his own life. So that's what we say empowering. Empowerment means making the person powerful. Not giving power to the individual. That is not empowerment. Empowerment means making the person powerful. Okay, friends. Now we'll go to other one. Counseling The important terminologies are over now. Now, what is counseling? Counseling is a behavior change strategy. A behavior change strategy involving direct contact with the client and is by definition a remedial process. Counseling is a behavior change strategy. Through counseling, you are bringing a change in the person you are bringing a change. What is the change? You are bringing a positive change in him. You are altering the negative behavior and bringing positive behavior. You are correcting his behavior because behavior is what you learn from others. Behavior is what you learn. Behavior ಅನ್ನುವುದು ವಂಶಪಾರಂಪರ್ಯವಾಗಿ ಇರುವುದಿಲ್ಲ. You learn the behavior, good behavior and bad behavior, you learn. When you learn something, there is a possibility of unlearning also, which you can do it. So counseling is a behavior change strategy involving direct contact with the client, face-to-face. Face-to-face contact, best form of counseling, personal counseling, face-to-face counseling. And by definition, it is a remedial process. Remedial process means, remedy means a solution. Process means series of steps. Through counseling, you can manage most of the problems. Essentially, counseling involves an attempt to help the individual mobilize his own resources and utilize them to resolve certain difficulties which confront him. This speaks of counseling means making the person, that means manage his own problem. You can help him mobilize his own resources. We believe that every individual is capable of taking his own decision. Every individual is worthy. If opportunities are given, every individual can manage his own problem. Everyone has a strength in him. That's why we say, mobilize your own resources. The resources within you, which you may not be knowing it, which the counselor is there to help them. Mobilize your own resources and utilize those resources to resolve certain difficulties which confront him in the life. Third one is counseling involves a professionally trained counselor assisting a client with particular concerns. It may be academic, it may be interpersonal, it may be family problems, it may be marital problems, it may be different types of problems. You use counseling in every situation. And what is counseling? Two definitions. One definition we give, very important one. Counseling is to empower the client to cope with the life situations. I repeat again. Counseling is to empower. Empowerment means making the person powerful. Counseling is to empower the client. Client means the person who is in need of help. He comes to you, you make him powerful. What? To cope with the life situations. What situations? As I said, events, occasions, and conditions. I say stressors. Reduce emotional stress. It may be depression or anxiety, reduce it. And to engage in growth-producing activities. That's called development of the individual. Don't think counseling means only problem-solving approach. It is not only problem-solving approach. Counseling is for prevention of a problem. We can prevent certain problems through counseling. So that's what we say, premarital counseling. This is called as a prevention. So to prevent certain problems, you use premarital counseling. So premarital counseling is a preventive step. You have different forms of counseling. All the forms of counseling are used to prevent problems. It is not only managing the problems, preventing the problems. The third one is to develop the individual. So growth-producing activities. So at 3 levels, counseling works. One is development. The second is prevention, and third is remedy or solution. And make effective decisions. The second one is counseling means rendering intellectual and emotional support for helping and developing a distressed person. In a limited way, this is defined. When a person is in stress, counseling will provide help